Hi Santa Sue, this is my daughter Danielle, and I'm going to show you how I do the straight leg reading test, so you can maybe start using it and see what you think. So first off, I always start with the asymptomatic side. I'll just take the patient up. I'll support their leg on my leg. I'll bring the toe up. Tell them to bring your chin down slowly, and then have them lean forward. And what they'll tell you is, I have this tightness pulling back here, and they'll basically want to quit usually about here. And I explain to them that's a nerve. Tell them to put their foot down, bring your chin up, and then I'll explain to them it goes away because it's not a tight hamstring, it's a nerve. Then I'll repeat it. But this time I'll tell them go as far as you can, really feel the pull down the back of the leg, and I tell them remember what it feels like. That's a normal nerve being stretched. And of course, while I'm doing this, it's surprising to find how many people have a positive cross straight leg raising. They'll either complain of pain in their left leg, sometimes it's just the back. It just kind of depends if the dura is irritated, nerve, or both. Then I do the opposite side. I go real slow on this side. I usually throw the toe down, because a lot of people, this is all you have to do when they hurt, if they have a bad nerve irritation. So again, toe up, chin down, tumbling forward, and invariably if they have any kind of nerve irritation, they'll just say it's tight or it hurts more. If I try to push them, the bad ones they'll break into a sweat, because you're really putting the nerve on tension. All right? And then I get them to go back up. And do watch as far as when I do this, I'll sometimes hold them for a while, 10, 15, 30 seconds. See if I can reproduce the numbs and tingling, because sometimes they'll tell me it's my big toe going numb, my little toe, thigh. It's amazing how many times you'll be able to tell which nerve it is by just holding this position, as long as they don't dislike you too much. So that's kind of that's done. And then the other one I do is, once I find out that it's positive, then I teach them how to stretch the nerve. And I do it a very specific way. So if this is Danielle's symptomatic side, I'll have her put the toe down, the chin up, and then tell her to slowly lean forward and feel the discomfort. And I'll tell her on the good side to do the same thing and lean forward and see the difference. Then what I tell her is she can stretch this one 4, 5, 6 times a day until it feels like this one. Then she knows she's progressing. And once she's done that, then next she can bend the chin down, a little more stretch on the nerve, and do that one until it feels fine. And then the last thing is she can start bringing the toe up. And it's just a real great way to teach people how to stretch the nerve root, and also you can follow progress. It's very simple to follow progress because the patient will come and tell you, I can do more of that. And the other nice advantage is, I don't know if I'm right or not, but it seems like the people that have control and stretch the nerve consistently seem to get better quicker, but it could just be kind of my imagination. The other one is that there's one syndrome I've seen in people. I'm not sure if it's described, maybe you guys have seen it, but because this is nerve root, if someone's carrying something, someone else drops it, they get pulled forward. You might have seen in football players, they're in the bottom of a pile, and they get thrown forward. They say they've got a pulled hamstring, and they take a long time to recover because if it's a stretched nerve of the injury, they seem like it's right in the foramen where it gets stretched, and they act like a disc herniation or nerve irritation, but all the studies look normal. They take a long time to recover. I've seen some people a year and a half longer before that nerve root is calmed down again. So I hope you guys have fun using this. Give me some feedback. Stu, I'll send you a little email with this as far as how we try to go about maybe writing this up and getting it in the journal. And then give me some feedback, you guys. Thanks a lot. Take care. Bye-bye. I forgot 2 things. So when you're doing the symptomatic side, when you get the leg up, keep the chin up. Have the patient lean forward until they can't go any further. Then bend the chin down. And what will happen is they have more dural tension sign, they'll complain of back pain, nerve pain, they'll complain more of leg pain, sometimes both, but it's a real sensitive way to pick up which one's being irritated. And the other one is I've had 2 patients, one a tumor at T2 and also one a spinal infection, disc space infection, that when I had him come forward and bend forward, they complained of thoracic pain. So again, it might be a way to really be sensitive even if picking up dural tension signs in the thoracic spine. So give it a try. I look forward to hearing you. Take care. Bye-bye.